Hello. Welcome to Healthy Us. In this video we will be looking at diabetes and the body. If this is your first time here or you haven't subscribed to Healthy Us yet, don't hesitate to hit the subscribe button. When you hear the word diabetes, your first thought is likely high blood sugar. Blood sugar is an often underestimated component of health. When it is out of whack over a long period of time, it develops into diabetes. Diabetes affects your body's ability to produce and use insulin, a hormone that allows your body to turn sugar into energy. Diabetes can be effectively managed when caught early. However, when left untreated, it can lead to potential complications that include heart disease, stroke, kidney damage, nerve damage and death. Knowing how diabetes affects your body can help you look after your body and prevent diabetic complications from developing. Many of the effects of diabetes stem from the same guilty parties, namely high blood pressure, high cholesterol levels and a lack of blood glucose control. When undiagnosed or uncontrolled, the effects of diabetes on the body can be noticed by classic symptoms like increased thirst, frequent need to urinate, fatigue, blurred vision and tingling or pain in the hands, feet and/or legs. Some long-term effects of diabetes include 1. Cardiovascular. Diabetes and coronary heart disease are closely related. Diabetes contributes to high blood pressure and is linked with high cholesterol, which significantly increases the risk of heart attacks and cardiovascular disease. High blood pressure and cholesterol also raise the risk of strokes. 2. Vision. Diabetes increases the risk of a number of eye problems, some of which can lead to vision loss. Short-term problems include blurred vision, due to high blood sugar. Long-term complications include glaucoma, diabetic retinopathy, macular edema, and cataracts. Having regular eye tests, managing blood sugar, and avoiding or quitting smoking can all help protect eye health with diabetes. 3. Digestion. Diabetes can affect digestion in a number of ways. Gastroparesis can happen when nerve damage interferes with the ability of the digestive system to move food from the stomach into the small intestine. This condition can result in nausea, vomiting, acid reflux, bloating, abdominal pain, and weight loss in severe cases. 4. Nerves. The effects of diabetes on the nerves can be serious as the nerves are involved in so many of our bodily functions, from movement and digestion, to sex and reproduction. Neuropathy, or nerve damage, is a common complication of diabetes. The presence of nerve neuropathy is commonly noticed by numbness or tingling in the hands or feet, lack of arousal in the penis or clitoris, excessive sweating or diagnosis of delayed stomach emptying. Treatment of this condition is very vital. 5. Kidneys and urinary system. Diabetic nephropathy is the term for kidney disease that affects people with diabetes. Damage to the kidneys takes place over a period of years and can be picked up by nephropathy screening before it gets too serious. Treatment includes lifestyle changes and may include treating high blood pressure and cholesterol in diabetic patients. 6. Sexual health and fertility. Diabetes-related damage to blood vessels and the autonomic nervous system may have a negative effect on sexual function and the body's ability to send and respond to sexual stimuli. Erectile dysfunction is more than 3 times more likely to develop in men with diabetes, and it can appear 10 to 15 years earlier than in those without the condition. Other ways in which diabetes can affect people's confidence in their sex life include the condition's impact on mental health and worry that sex may lower glucose levels. In women, menstrual irregularities are common once menstruation starts, and menopause may start earlier. Diabetes can also cause pregnancy complications, therefore, good blood sugar management during the entire pregnancy is essential. 7. Skin. Diabetes' effect on the skin is usually a result of its effect on nerves and circulation, which can lead to dry skin, slow healing of cuts, burns and wounds, fungal and bacterial infections, and loss of feeling on feet. People with diabetes are recommended to have their feet checked at least once a year. Calluses and foot sores can also pose secondary problems. If wounds develop from these, ulcers can appear. Without attention, a foot ulcer can become dangerous, possibly resulting in the need for an amputation. The effect of diabetes on the feet is often referred to as diabetic foot. This is one of the many causes of death in diabetic patients. 8. Metabolic effects. Metabolism is the process by which the body converts nutrients into energy. Disruption to this process can lead to various life-threatening complications, such as diabetic ketoacidosis (DKA). This happens when the body cannot use glucose for energy, so it starts to break down fat. As it does this, it releases chemicals known as ketones. High levels of ketones make the blood too acidic. Within a few hours, the patient starts experiencing signs and symptoms such as a dry mouth, nausea and vomiting, stomach pains, shortness of breath, loss of consciousness, coma and death, if treatment is not initiated immediately. DKA is most likely to affect a person with type 1 diabetes, but it can also happen with type 2 if blood sugar levels rise too far. 9. Mental health. Diabetes can affect a person's mental health in many ways. Learning as much as possible about diabetes can help reduce stress. The more a person knows about their condition, the more control they will feel they have over their diabetes and its treatment. Knowing what to do in each situation can boost a person's confidence and leave them feeling better overall. Working with a healthcare professional can help to minimize these problems. A doctor or counselor can help make a plan to reduce the risk of mental health problems. Diabetes can disrupt daily life, but a person who manages their blood sugar levels well has a good chance of living a full and active life. Hope this video was helpful. Like, leave a comment, share with your loved ones, and don't forget to hit the subscribe button. Thank you for watching.